Hi, everybody, and welcome to another E-QIP webinar. Today, we're going to be looking at enhancing the joy in work for professionals through healthcare improvement, and we're going to be joined by very distinguished Dr. Chris Hayes. So a little bit of housekeeping before we begin. If this is your first time on GoTo for one of our E-QIP webinars, welcome. And we ask that you hold all questions until the end of the presentation. You can type them into the question bar, but we won't actually be answering them until the end of the presentation, and we'll have some time for some discussion there. And you can minimize your control panel by that little orange arrow that you see, and that'll move it to the side of your screen, and you can enlarge it again as you go. We'll also make sure to send out after the webinar any handouts, links to the recording of this session, as well as some helpful resources for you. At this time, we'd ask that you take a minute and let us know how many folks are joining you today in the room or the city you're watching from. That can be helpful for us just to know what the total audience is. So if you take a moment, enter into the chat bar the number of folks that are joining you, that would be very helpful for us. Also, we're trying to get ever present on social media, and invite you to join in the conversation on Twitter using the E-QIP hashtag, which is hashtag E-QIPON. And on there, you'll find conversations. We share interesting stories about quality improvement in the community mental health and addiction sector, and invite you to be part of the conversation. There's some fun stuff on there you can check out. So I'm Michael Dunn, Director of Quality Improvement at CMHA Ontario, and the co-lead for the Excellence Through Quality Improvement project. And I co-lead along with my partner, who's in the room as well, Debbie Bang, Director of Quality Improvement at Addictions and Mental Health Ontario. And today we're very happy to be joined by Dr. Chris Hayes. Dr. Hayes is a 2013-14 Canadian Harkness IHI Fellow in Healthcare Policy and Practice, where he spent a year at IHI researching strategies to improve the success and sustainability of quality improvement initiatives. Formerly, Dr. Hayes was a medical director of quality and performance at St. Michael's Hospital here in Toronto, and that was from 2006 to November 2016. From 2008 to 2015, Chris was medical officer for the Canadian Patient Safety Institute, where he chaired the Canadian Safe Surgery Saves Lives program. He is a recognized leader in patient safety and quality improvement, working with regional, national, and international organizations, and has received multiple distinctions and awards. And I can say, having been a student of Dr. Hayes at IHPME, that we're very, very lucky to have him today. He's a great leader in this area. So without further ado, I'll pass it over to Dr. Hayes.
Thanks so much, Mike. And it's very joyful to be here, and I hope as much as this is a sobering topic, that you will gain some enthusiasm and hopefully some direction for something you can do next Tuesday as it relates to enhancing joy in work for professionals using quality improvement. So there's lots of methods to improve joy, but we're going to talk primarily about how you can use quality improvement as a tool to do so. I don't have any financial conflicts of interest. I'm always looking for them, but they don't seem to come my way. It's just the only conflict is I'm very passionate about this topic. So hopefully in the next sort of hour together, and with lots of times for questioning, that we'll be able to, by the end of the session, to be able to describe the implications of joy in work for quality of care and patient experience, recognize the attributes that contribute to joy in work, and then identify strategies that we all can use to increase joy in work, either personally or at an organizational or team level. So I'm hoping people might have seen the triangle that is probably the most dominant strategy from a health perspective across the globe. Pretty simple, called the triple aim, with the goals being that the main goal is we should improve or increase the health of the population. For those that need health care, improve the experience of that care using the Institute of Medicine quality domain as a framework. and by doing so, or at the same time, drop the per capita cost. And so the idea is that if people are healthier and the quality of care is high, that naturally you'll reduce the cost. It's the simultaneous pursuit of all three of these aims. And it would come as no shock that achieving the triple aim is at some point going to require providers or frontline managers or people that are interfacing between the care of patients, the care of populations, and the system. And in fact, in many ways, many of the outcomes would be dependent upon the efforts and the contributions of the healthcare team. And in fact, I would say that, and for those providers that are in the audience, or you don't have to be providers, that really that if you're working in the health and healthcare sector, you're probably doing it, well, you're not doing it likely for money, because you can get into the financial sector for that. You're probably doing it because of the opportunity we have to work with people. And this quote came out of the Lucian Leet Institute when they did a report on sort of the psychological safety of healthcare. And essentially says the service mission of people caring for people in time of their greatest vulnerability and need. This is the mission of the healthcare workforce, the mission from which its members derive their purpose as well as their experience of joy. And so as a ICU physician, I fully believe that this is true, that the reason I'm in healthcare is because I thought it's a calling, and I derive both privilege to do it, to interact with people at times of great vulnerability, but I receive joy, especially when I know that I can provide a good outcome or a good experience for those that we serve. So experience of joy is tied to what we do. Yet, there are numbers, and these are probably high for Canada, but up to 60% of providers say they are burned out on their jobs. In one report, 34% of nurses were planning on looking for at least either a new job or a new place for employment. Which is an oxymoron, that the industry that we've created to care for people is one of the unhealthiest. We take more time off work than most other industries. We have more physical injuries than most other industries. And we probably have, it's not the best reports yet, but we probably have some of the highest mental health issues as an employed sector than any other industry. So this does not match the service mission and the joy that we should be experiencing by providing care to others. And so here's even more recent as far as it relates to physicians. So this was the National Physician Health Survey that was published in October. And they've got numbers that say 26% are experiencing high emotional stress, 15% high depersonalization, with an overall burnout rate of around 30%. And the quote there is really saying that despite us working on this is actually a growing problem rather than a problem that is being diminished, and therefore requires a huge amount of effort if we're to protect the delivery capabilities of the healthcare system and ultimately achieve the triple aim. So as I said, these are highly dependent on achieving these. And if your workforce is not at its optimal best, then you will not achieve the triple aim. The triple aim will cease to be an outcome if we don't address the joy, the experience, the wellness of the workforce, as we say here. And so here's just this other term, so joy in work and triple aim. So if you put in sort of the well-being or the vitality of the workforce into the triangle, then it becomes the quadruple aim. And really what this is saying is that in order, you have to simultaneously work on the wellness of the healthcare workforce as one of the key aspects in the triple aim if you're going to achieve the societal and patient benefits. So now I'm going to ask you in the chat, hopefully, I'm sure all of you have experienced joy in your work, whatever that environment is. But how about you in the chat line there? Start contributing. What do you think those elements are that contribute to you or your colleagues experiencing joy in work? So we'll give you some time to do that. And okay, so if you see, you should have access to the chat. Let's see. Or is it in questions? Oh, you use questions. Well, there's lots of things coming in. That's great. Can everybody see these as well? Okay. So hopefully we'll be able to share. But so a lot of things that are coming out, sense of making a difference, sense of purpose, support by colleagues, supportive work environment, making a difference, being recognized for those, some trust and safety within the environment, the ability to grow, respect from leadership or management. And so as you keep contributing, so these are the exact same themes. Every time I've done this, the exact same themes come up. It is around sense of contribution, sense of achievement, sense of purpose, sense of belonging to a team that's supportive, and sense of recognition. So that's not a healthcare issue. So those elements of joy in the workforce cut across all industries. And then the other one, which I'm seeing here, is that when you have the ability, you have the resources and the ability to do your job. So you put all those things together, and that's known. We've known this for decades, that those are the elements that produce a joy in the workforce. So now I'm going to ask you, again, sort of the opposite. What in your day-to-day experience impedes you experiencing joy in work? So being overwhelmed, being disrespected, feeling underappreciated, feeling not heard by leadership, bureaucratic processes, too much documentation, sort of status quo where, ideas for improvement, but they don't go anywhere, feeling like the team's not contributing or carrying the weight, lack of transparency and trust, lack of time, lack of resources or tools. Let's see if a couple more come in. Disengaged leadership. So as these continue to come in, so there's a bit of a difference here. So yes, some of them are the opposite of the things that contribute to joy, but there's more of a tangible, like a work environment, resources, time, because time didn't necessarily come up in what contributes to joy, but the resources in the environment very much come up in impeding your ability to experience joy. And I definitely want you to keep time and resources on your mind, because we're going to talk about it further. So thanks very much for that. And so fortunately, and sort of I've been doing this work for a couple of years now, fortunately, there is increased attention to the healthcare workforce as a means to the triple aim and, as a valuable asset unto itself that needs to be protected. I had the privilege of working at IHI and with IHI in their joint work strategy, and they produce. I mean, there's probably other frameworks out there, but I think this one is, sort of topical, I think, and it's usable, and it was designed to be something that people can use in order to address joint work. So this was produced last year, or maybe it's 2 years old now. And it's a great document. It's available at ihi.org, and I highly recommend everybody to download it. So there's really it's a step-by-step process that you can follow, both what to work on and how to do it. And it wouldn't be surprising, probably, if you know anything about the Institute for Healthcare Improvement, that one of them, or the fourth step that they have stated as a mechanism for addressing and improving joint work, would be to use improvement science. And since this is an audience of improvers, that it would make sense that we use improvement science as a mechanism to improve not only system performance, patient experience, and outcomes, but also joint work. But I will tell you that the way you do this will have different outcomes. Because it's possible, and I'll explain why in a minute, that through the passion of improvement and implementing change for the better, that you actually make joint work worse. And so one of the strategies that we'll talk about is, how do you implement change through quality improvement that avoids worsening joint work? And then the other outcome is where you actually focus your improvement efforts, specifically with your aim statement being on a joint work strategy. And so we're going to talk about both of these more. So I had the opportunity to leave St. Mike's for a year and go down and do a Harkness Fellowship, and I sat at the Institute for Healthcare Improvement and studied high-performing healthcare centers, mostly in the U.S., and went to visit them and work with them. And, sort of with the vein that, if they've made the list of being these, places that do quality improvement well, how are they able to do it where I back at St. Mike's found it very challenging to have sustainable goals? And so the idea was, how do they do quality improvement and sustain quality improvement with a specific angle to say, are they doing it and not creating burden during their improvement efforts? And so in order to address this, really I went down with the idea that, in an effort to improve healthcare, we can't make it harder to provide care. If we do, there's no way we'll be able to continue to achieve sustainable goals. And so through looking at the literature, through site visits, through interviews, and pulling an expert panel together, we developed the highly adoptable improvement model as a framework for driving quality improvement without burdening the workforce. And so in this diagram, in the middle, the blue icon represents the recipients of change, those people who are going to have to do or act or behave differently as a result of your quality improvement intervention. And within them, there is this dance that's going on between these three constructs: perceived value, workload, and capacity. And they interact with each other. So perceived value is the sense that if I'm going to be offered an opportunity to do something, presented with change, or a decision to make, that I will choose or accept an option or make a decision that I find to be perceived to have value. To me, the things that are important to me. So as an example, outside of healthcare, if you're you watch that Ferrari go by, you sort of feel tingly. You've always wanted that, and you're assessing whether the perceived value. Now, perceived value has three components. One is emotional, meaning again that your heart races, your pulse goes up a little bit. That's the emotional side that sort of tugs at your heartstrings. And then there's the practical side. Can I do this? And the logical side, does this make sense? So if you're buying a Ferrari, you like it, but you live in Northwest Territories, and you only need it to get from here to work, which is a short distance. It's probably not practical or logical to buy a Ferrari, but emotion will trump those other two by a lot, which is why you shouldn't watch infomercials at 2 a.m. because your practical and logical mind are suppressed, and you'll make a choice based on the emotional side alone. So there's perceived value, and people, whether they're presented with change or option, they will evaluate their feelings towards that. So the other constructs are workload, meaning how much cognitive, physical, and actual time does it take to do the tasks? Or how much physical capacity do I have to do this? And so these things interact, because if you really value something, you will underestimate the workload and overestimate your capacity. And then you'll take it on. Then you realize that the workload and capacity actually are significant. And so actually now's a perfect time for where your New Year's resolutions start to fade off, because you're like, wow, I really want to do this. I still do, but it's hard. Now you have two choices. If you find something that's really of value, you've probably created cognitive dissonance, which says, I want to do A, but I'm currently doing B, and you've got to reconcile this. So there's only two ways to reconcile it. One is to achieve the goal, or the second is to devalue, because it's very stressful to live in a world where your brain is telling you should be doing something different, but you're not. And in fact, it's a contributor to major depression if people can't get out of this sense of cognitive dissonance. So you'll end up devaluing, even though at the beginning you felt that it was a good cause. Now, the opposite, where there's no perceived value and the workload will be overestimated, in which people will say, I don't want to do any of these activities because I don't see the value. And so my role now on my second run of implementing electronic health record across two systems, people tell me 3 clicks is like the end of the world. But if I presented you, it'll take 90 clicks, and at the end you'll win $100. People would do that 90 clicks in a millisecond, right? So it's all about value and workload are very tied to each other. So anyway, that is going on in the environment. You as a quality improver, as a change agent, are going to be able to manipulate this environment in 2 ways. One is through the intervention design, meaning what are you actually asking people to do? What are the tools? What are the practices? What are the things, the new skills, the new knowledge that they'll have to gain? And the second way is through the implementation strategy. How are you going to go about asking people to do this? The mechanism of change, the way you engage with people. So the model produces sort of 2 dichotomous outcomes. So one is based on your intervention and strategy having low perceived value and increase workload or decrease capacity. And the literature is very, very clear what happens. You induce burnout, change fatigue, change cynicism, force people to do workarounds, and increase the likelihood of error. And since they can't do the tasks reliably or don't want to, then you are less likely, now, can I close this? Yeah, thanks. You're less likely to achieve the intended outcomes of the project. And both of these things have, negative feedback on those recipients of change or frontline providers, whoever they are, because they say, wait a minute, you said that things would be better and patients would be better, and that's not happening, and my life is harder. I don't like this quality improvement stuff. Don't come back. This strategy will build resistance. You will be building resistance into the environment, in an effort to improve that environment, because it's not perceived as valuable and or it's increasing their workload. So the other strategy is one where you design for high perceived value, decrease workload, or augmentation or increase capacity. Literature is also clear. You're able to sustainably adopt, people are more likely and more willing to adopt the intervention, the new work. And if the science is correct, meaning if they do A, B will happen, you're more likely to achieve your intended outcomes. And this has positive feedback on the recipients of change, because they're like, wow, look what we achieved together, and it wasn't that hard. I love this quality improvement stuff, let's do it again. And in my visiting some of these high-performing healthcare centers, their strategy was the green strategy. And people, they did not feel burdened. They did not feel like change was thrust upon them. They were a part of that change, and then they saw the outcomes and shared and were proud of the outcomes they achieved. So red strategy, try to avoid. Green strategy, try to design for. So nice model, maybe makes sense. How do you do this? What drives a good intervention design or implementation strategy? And so actually, I'm not going to, all of what I'm going to talk about or about the model is available at highlyadoptableqi.com. And there's the article there on how we produced it. But essentially, in that is a 6 evidence-based categories that we developed to try and drive people to think, mostly to think and then act on how to increase adoptability. And they ranged from, well, probably the most important, which is involve the people who are going to be changed in the change. The more they're involved at every step of the process, the more likely they are to see value in what you're doing or what they're doing. And they usually, when they're asked, they don't design an extra hour's worth of work themselves. Alignment and planning is the second one, which says, if this is so important, then give it the space and time and the planning that it deserves. Don't throw 5 initiatives at people and expect them to be able to adopt them all. Resources required. Do you know what it will take from a training, skills, equipment, human resources, time perspective in order to do this? And are you going to provide it? Workload. Are you going to measure cognitive, physical, and time? How much time does the new task take? How much mental power does it take? If you measure those, you're more likely to understand the impact and then maybe simplify them by looking at complexity, which is the next one. How complex is your intervention? Could you achieve it with less steps? Could you remove the need for humans altogether? And the last one being efficacy or perceived efficacy, meaning do people believe that if they do A, they will achieve B? Like, what evidence do you have to say that, we're going to do this checklist and it's going to save lives? Well, where are you getting that from? Like, explain the rationale. And that satisfies the logical part of the perceived value equation. So we could talk lots more on that. And again, there's lots of strategies that are in the toolkit that's on highlyadoptableqi.com, and happy to talk about that more in the social media world or by email. But I want to now move to the second aim as far as it relates to using improvement science to test approaches to improving joy and work. And that's by making the explicit aim around a joy and work strategy. So just to share that, what are the other 3 in the IHI framework? So the first one, which makes total sense, there's now a movement out there that says to patients or clients, what matters to you, rather than what is the matter with you, or, you've got diabetes, so therefore we're going to do this, we're going to offer this therapy. Stop and ask patients or clients what matters to you. Well, we should be asking our staff the same thing, and they will tell you. Identify unique impediments to joy and work. You listed a whole bunch of them, and those are good ones to start with. Eliminate impediments, and you're more likely to allow joy and work to occur. Commit to a systems approach to making joy and work a shared responsibility at all levels of the organization. Like quality improvement, this joy and work is not you can't have, teas and pizza lunches as a strategy and say thank you to everyone and that be enough. It really has to be part of a strategic plan, strategic aims and goals. If it were my way, it would be in every quality improvement plan that we have to do in Ontario. There should be how are you going to address health system outcomes, i.e. the triple aim, and how are you going to address the well-being of the workforce. But it requires board, executive, middle management, frontline management, providers, everybody needs to be involved. And then obviously the fourth one is improvement science. What do you work on? What contributes to joy in work? So this is sort of the IHI Wheel of Happiness, and they've identified, and this was through the literature and then a ton of stakeholder feedback on what are sort of the categories of work that categories which contribute to joy in work, or at least safety. So the first one, physical and psychological safety. So if you don't have a safe environment, it's hard to feel joy. Meaning and purpose came up, loud and clear in what you described. The ability to do what you've been trained to do and feel like you're making a difference. Having choice and the ability to make decisions, choice and autonomy is huge, especially with professionals. Recognition and rewards, receiving feedback from whomever that you're making a difference, or you're contributing to better. Participatory management really is a QI, having people involved in the work that they do, creating camaraderie and teamwork. And then again, this is the sort of the IHI part, is daily improvement, having people being an active contributor to the system getting better, using real-time measurement to support that and demonstrate that things are getting better. And then individually, focusing individually on your own wellness and developing resilience. And so there's a whole movement now on resiliency training in the healthcare space. I think it's a great thing to do, but I also think that we should probably be looking at reasons why people need to be more resilient and actually making it easier for people to do their jobs, so that they don't need to be as resilient. But resiliency training, given that healthcare is very complex, stressful, and emotionally involved, is a strong strategy. The outer rings just say what individuals can do themselves, what managers and core leaders, and what senior leaders can do. So those are the 9 elements of the Wheel of Joy. And it's really meant to help leaders assess and then create strategies and goals and plans and processes to achieve or to address joy in work. Now, 9 is too many for me to remember, so we introduced sort of this 2x2 model that people can work on, so you can see that on sort of the lower column is personal strategies. So you don't have to wait for your organization to create a new strategic plan around joy in work to increase joy. You can do this yourself, or as an organization or a team or a department, you can take this on. That's the top row there. And then there are 2 areas that you can focus on. So personally, you can focus on the work environment, the people that you work with around you, and trying to have that contribute to better joy. And then again, going back to the core of health and healthcare delivery, purpose and meaning. So you can personally focus on purpose and meaning, or organizationally you can focus on purpose and meaning. And just to give you a few examples of, there's lots in the IHI toolkit, some that I've experienced. So I just moved from St. Joe's in Hamilton. I'm now with Trillium Health Partners. But at St. Joe's, they developed a program in the ICU called the 3 Wishes. And the 3 Wishes was really meant for patients and families to experience a more dignified and less tragic death in the ICU. And so merely what we asked them is there anything that we can do to make the environment, your loved one or yourself, better at the time of death? And this would be music or food, or song or, stories. They celebrated, they told us what they wanted, and we provided that. So What happened, though, is the providers that were involved in creating this environment where it was clear that the families felt better about the dying process, and that they thanked the team. The reciprocal joy and work that was gained through this initiative was huge. So now it started as a little project. It's now absolutely part of every death in the ICU at St. Joe's, and it's now moving across North America and the world as a strategy to both help patients, but in helping patients and families and seeing that you've made that difference, you will gain joy. Also in the ICU, sort of how are they now? So this is where, we discharge people from the ICU and, they were near death for most of their time. And then they come back and say, I finished school, or I got my job back, or I've achieved X, Y, and Z. And it makes you feel that there's purpose and meaning. And so these are, two things that a unit could do at an organizational level to increase joy. Personal side, and some of this is, again, personal, and from a strategy we saw out of VHA Nursing, our home care nursing provider. And so one of the providers said, I keep coming in to work for a client, and I've got this list of things that I need to do and priorities that were set by someone else. But I don't feel like I'm engaging with the client. I feel like I'm rushing them around so I can get all this tasks done. I decided to just sit down and essentially ask what matters to you, to the client. And the first thing they said is, can we have a cup of tea together? And that made all the difference in the world for that client. Now, they didn't make the whole list, but they got through some priority. And actually, that was a personal support worker, said, now I'm making a difference. So sitting down with your patients or your clients and talking and sharing and being a part of their lives will increase joy, and we can all do that starting tomorrow. At an organizational work environment level, there's things called buddy programs where, if like what's your onboarding process for new staff? Healthcare is a challenging, industry, and, it can be scary for people to move from one place to another or to start their career. Start buddy programs, help people become acclimatized to the work environment, feel like somebody there cares for them, makes a big difference. And then, these tea time, just stopping and saying, let's talk about how we're all doing as a team. Or another one, which is good for your health as well, is, go for a walk and meet at the same time rather than sitting behind a desk. That physical activity will contribute to joy. And then at the personal level in the work environment, connecting with your teammates and your colleagues. So just make an effort personally to be more open to people. And they will probably start to be more open, and you'll just feel better about yourself for reaching out. And then again, resiliency training that you can undertake yourself. And one of the strategies that you may have heard his name's Brian Sexton, and the work he's doing is at the end of the day, you go home, and he's got this app because it's a part of a research project. At the end of the day, you just say, it could have been a horrible, horrible day. What are 3 things that went well? And if it even gets to the level that you poured the perfect amount of cream into your coffee, take it, put it down. It's known to improve your mental well-being and increase your resiliency and your joy in work. So in order to target joy in work as a strategy, pick one of those 9 components or one of the quadrants to work on. Establish workplace, work-centric measures, and ensure that they have meaning and value with the workforce. So, you might say sick time. That's a good organizational metric, but does that resonate with they want to see that things are happening. So make sure that those metrics make sense to the workforce. Choose change strategies or change interventions that address impediments to joy in work. So if people are really telling you, if the overwhelming majority says this is a problem, then work on this. If you work on something different, it may not impact joy, and it may not show that you're committed to it. Test and revise joy in work strategies with those that are impacted. It's the same as quality improvement. Don't introduce something and have no evidence that it's working, or don't give them the opportunity to make changes to make it better. So my call to you is, in sort of the Don Berwick way, is what can you do by next Tuesday? So commit to one quality improvement initiative that's aimed at improving joint work. Now, I know as improvers, you've probably got a lot of things that you have to do to improve system performance, patient outcomes, or patient experience, but try and squeeze in one that's directly aimed at your colleagues, your workmates, the staff in your organization. And the last thing I'll put down, and we'll definitely try and hopefully this, is, hearing what you've heard, what strategies either have you used or are you thinking of using to improve joy in work, either for yourself or for your organization? And actually, so that's the question. Please start filling that in the question box. And I'll close by saying that if we want to achieve sustained healthcare improvement and ultimately the triple aim, we have to have and focus on a vibrant and well workforce. One of the strategies to do that is by focusing on joy in work, or the quadruple aim, through two strategies. If you're going to introduce change, ensure that aim that it's of high value amongst those that have to be changed, and that it doesn't add unnecessary burden or workload, or work directly on improving the meaning and purpose, or the experience of meaning and purpose, and the work environment for your staff and colleagues. There are frameworks and tools that are available, and I truly believe that quality improvement is the mechanism we should be using to experience joy in work. So again, there is the website where the high adoptive improvement model work is, and there's 3 ways that we can stay connected in our combined effort to make the challenging but rewarding industry of healthcare more joyful. So thank you.
I'm going to say I purposely at the beginning skipped past the slide. So I wanted to make the point at the end that all of the stuff that Dr. Hayes talked about are things that hopefully we can help you with through E-QIP. As you know, we're the resource for community mental health and addictions around quality improvement, and our coaching and our community of practice, and all of the offerings that we do are really to help folks use quality improvement methods and tools to make the quality of the care we provide for our clients a little bit better. And one of the ways that we can do that or look at that is through looking at the joy of work, because we know that if folks are happy and feel fulfilled and have joy in their work, as Dr. Hayes spoke about, that often translates to even better care for our clients and families. So I would encourage you to get engaged with us, and what we do is really support that quadruple aim that Dr. Hayes spoke about, that trying to support healthy communities, doing that through the best possible client care in a way that's cost efficient, but also in supporting our dedicated staff, because this work we all know is not easy work, but we do that through the model for improvement, taking that QI lens and applying that to those areas that we can hopefully make improvement. So hopefully you'll be willing to take up the challenge. We invite you now to please share any questions, comments you have about today's session, and we'll have a few minutes for Dr. Hayes to take some time to answer those. And while you're typing away, all of the resources that were shared today, as well as some additional ones, are available to you on the E-QIP community of practice. We'll also be sending out an email following this webinar with links to the recording from today, as well as the material, and to those different resources that we talked about. So if folks have any questions, we can take some time and answer those. Or maybe folks are just feeling really joyous and don't have any questions at this point. That's okay too. But we'll give you a minute for any questions you might have.
And thanks to those people because we've got some examples here of what people are going to do to address that joy in work. Again, celebrating birthdays and recognizing small improvements. It doesn't take much to at least start. Connecting with coworkers for lunch. In fact, so there's evidence now that the Mayo Clinic has produced, and let's see if I get this term right. It's called commensality, which is eating together. And so they actually measured cortisol levels sort of pre and post in the people that contributed at the Mayo Clinic in just sitting down having lunch together, and all sort of stress hormone levels started to fall in those that participated. You just go and eat together, and I know it's not very North American, but in Europe, I think you go. Well, first of all, staff get, I think, free lunches. Physicians get free lunches, which is I don't know where that money's coming from, but I think they may even get a glass of wine at lunch. As what's one glass of wine going to do in your day? And wow, imagine that, right? Rather than sitting behind your desk, eating your lunch by yourself and working, and if you don't have people to go and have lunch with, just go for a walk. Like, these are things that you can do by yourself. And then there are other strategies that people have placed here, which is organizational, because again, yes, you can do things personally, but the healthcare system and its organizations have to address this beyond just the personal side. So there's a question that came in, what is the role of spiritual practice towards enhancing joy in work? And then this is particularly in the light of secondary trauma. So absolutely. I mean, I think we need to all recognize that, there are, sort of bad and difficult things that happen in care provision that are hard to handle. We tend to, in healthcare, sort of bottle that up and not openly talk about it, which or disassociate ourselves from the source of that, whether it be death or trauma or violence, whatever it be. But I don't think that helps. So there is, there's lots of places now that have, sort of these debriefing around, events that have occurred, or, really, certainly in the ICU, if sort of, unexpected and tragic death occurs, to really address that, and to focus, on the spirituality of it. I think that's something else we don't do enough of. It's very easy to talk about the biomedical parts of healthcare, but people are more than that, both our patients, clients, and ourselves. So I do think it plays a big role, but it requires that safe space to open up and talk about it, which you can do as a team, but an organization has to be creating these spaces and providing these resources. And in resource-strapped times, it's probably challenging to say, let's take some of our total budget and apply it to workforce well-being. But every industry that's done so, every company that has done so, actually improves their bottom line. I mean, in the for-profit world, it is an absolute strategy to get better pay, better productivity, better profit, and obviously recruit better talent, focusing on your workforce, and not doing that. And I think maybe a more challenge of a concept in a publicly funded industry, but needs to be there, especially in healthcare. Yes, somebody's put in the joy. Joy in work needs to be incorporated into a leadership model. Otherwise, it functions as a side. Absolutely, like it really does. And I'm waiting to see. I mean, there's some examples in the Mayo Clinic is a good one. I mean, they really are addressing this head on. It is a huge part of the work that they do. And again, I want to see some brave leaders put, I would like priority one QIP strategy for whether it be long-term care or primary care or acute care to be, we're going to improve, we've got a metric to improve the well-being of the workforce. I haven't yet. Maybe there's one out there. I haven't seen it yet, but that's a big brave step. And I think this comment that it's easy to say these things, it's harder to do them, and that's why you need a toolkit like the IHI one, or something that says, well, or research Mayo and say, well, they actually did this. How do we do this? Rather than, you got to walk the walk. You can't just talk it.
I don't know if there's any last questions. I think I know the improvement I want to take. I think it's a glass of wine at lunch in the office from now on. Yeah. We should do that as a team.
Yeah.
Well, thanks again, Dr. Hayes. Before we end the webinar, I want to remind folks that we encourage you to join the E-QIP Community of Practice housed on the Quorum platform. Anybody can join and be part of the conversation on there. We've got discussion boards, we have resources, tools, all of the stuff we talked about today as well will be posted on there. And our discussion for the next little bit is actually asking you as providers who work in mental health and addictions care, what strategies have you found to be effective in engaging your team members to build a culture of quality improvement in your organization? And how did you overcome any barriers? So we'd really like to get some new information and learn from you about your work in QI and help fuel others to do the same. We're planning some future webinars, including sustaining your gains, taking a look at sustainability of QI and some of the successes and preventing risks that can sometimes halt sustainability. And that's going to take place on March 21st, so you can join us for that. Health Quality Ontario also has some webinars that may be of interest to folks. The first one is the indicator webinar, and the second is using the model for improvement at a micro health system level. And some other events that you may want to save the date for: the CMHA annual conference, April 1st and 2nd, will be here in Toronto. And it's actually taking a bit of a QI focus this year, looking at that culture of quality improvement and building a better system together. Also on the horizon is the annual Addictions and Mental Health Ontario Conference, May 27th, 28th, and 29th in Toronto. And again, I know from my partner Debbie here that there's going to be a lot of great quality improvement content on that day as well. We also have our Quick QI webinar series, so if you're interested in learning about any specific tools in quality improvement, in that model for improvement, you can click on and watch any of those webinars. They're about 15, 20 minutes long each, and you can get a little refresher or primer on quality improvement tools. And all of our webinars, including the one today, will be saved and shared on our YouTube channel, along with past webinars, things like involving clients and family members in quality improvement, how to build a quality improvement culture, the role of data in the QI process, all kinds of exciting and fun topics. And last but not least, everyone's invited to sign up for our E-QIP newsletter, which comes around probably every 2 months and includes all kinds of information about different projects that are going on in the province, lots of resources, upcoming events, and stories from the sector, stories that you're telling us and sharing with us about quality improvement and what that looks like for you and your clients. And as always, if you're interested in learning more about E-QIP, talking about quality improvement with a couple of QI nerds, anything, feel free to email Debbie or myself or Jenna or Ashley. We'd be happy to chat with you at any time. So with that, thank you once again to Dr. Hayes for taking the time and sharing your wealth of knowledge with us. And thank you to everybody who tuned in today, and hopefully you'll take the challenge and look to improve joy in your workplace. Thanks very much.